In the book Levels of Health, Professor Betholkas explains that when the health of the organism is compromised with chronic disease, its sensitivity towards stressors reduces. It is not further affected by the stressors. It is like a corpse on the ground which cannot fall further down. But when the optimum health is achieved by the homeopathic remedy, it again becomes susceptible to the strong stressors. A strong component of stress can throw out the balance of organism, and it acts like an antidote that will bring a relapse of the previous cured condition. Hello viewers, this is Dr. Kaleem Khan. Welcome to you in Homeopathic Study Circle. In this video, I am going to talk about what are the antidotes to homeopathic remedy. So let's start and learn something new. The use of conventional drugs like cortisone, prednisolone, tranquilizers, sedatives, anti-inflammatory drugs, the use of these drugs interfere with the action of the remedy. Also, the strong antibiotics affects the homeopathic treatment. So, when the patient is taking homeopathic treatment, so during the homeopathic treatment and after the homeopathic treatment, he should avoid taking all conventional drugs. Vaccinations can have deep and long-lasting effects. When vaccine is administered after homeopathic treatment, it relapses the case, it interferes with the organism, and it disturbs the harmony of the patient. If you want to know more about vaccination and homeopathy, you should refer the book Science of Homeopathy by Professor George Betholkas. Second is recreational drug. Recreational drugs like marijuana, cocaine, heroin, hashish, ganja, afim, such type of drugs must be avoided in all cost. However, the moderate use of tobacco, cigarette, bidi or alcohol has not found to affect homeopathic treatment much. As you all know, coffee is a universal antidote. So, in all the cases of homeopathy, whether the patient is sensitive to caffeine or he is not sensitive to caffeine, but he must avoid taking coffee in any form. There are many soft drinks also containing some amount of caffeine. A regular basis of taking those soft drinks also can relapse the case and antidote the homeopathic remedy. However, the black tea or the milk tea is permissible. Dental treatment. In some kind of dental treatment, it is seen that the dentist is using the combination of conventional drug as well as the anesthesia. So the anesthesia also antidotes the homeopathic treatment. If the patient is under homeopathic treatment, he must avoid taking all conventional drug as well as the anesthesia. If he takes the anesthesia, he may antidote his chronic condition. Similarly, the use of medicated Ayurvedic herbal toothpaste also antidotes the homeopathic treatment, because all those kinds of toothpaste contains some amount of anesthetic agent, which on the regular basis can antidote the homeopathic treatment. Wrong repetition of remedy. If the case is partially relapsed and you are not sure of the remedy is not clear, and if you repeat the remedy which you have already given, that may relapse the case further. Or if you give some new remedy where the remedy is not indicated totally, that remedy may relapse further or antidote your chronic condition. The good effect of homeopathic remedy, which is achieved by correct remedy, can be antidoted by wrong repetition of the remedy. Other therapeutic modalities such as Ayurveda, acupuncture, herbal medicines, they may interfere with homeopathic treatment. All the therapeutic modalities which has some or the other effect on the organism can antidote the homeopathic treatment. Severe mental or emotional stresses. Severe mental or emotional stresses like grief, shock, financial stress, loss in the business, failure in examination, or bankruptcy. Such kind of strong stresses can antidote the homeopathic remedy. So the practitioner must consider all the circumstances while repeating or giving a new remedy. Strong odors. Strong odors like deos, perfumes, antiperspirants. And sometimes the strong odor uh, hampers the effect of homeopathic remedy. So when you take the remedy, that remedy is not active. That remedy is not active. You are just taking the plain pills. So it will not act. So you also have to avoid the strong odors. Instead of that, he can use perfume on the clothes. Similarly, camphor and the products containing camphor like oils, liniments, ointments, balms, where the camphor is mixed, that also has to be avoided because camphor also antidotes the homeopathic remedy while taking homeopathic treatment or even after the treatment. Okay viewers, I hope this video will help you to understand the homeopathic antidotes, what are the factors that affects the homeopathic treatment. So in your future cases, you can advise your patient that they must avoid all such kinds of antidotes. The purpose of making this video is to make aware of your patient not to use such kind of antidoting factors, because when the patient comes with a relapse, patient does not know why his conditions are getting worse. He go into relapse, but when he comes to us, we have to encounter all the antidoting factor. We have to rule out all the antidoting influences. We should look whether the patient is using any kind of antidoting things. So we must tell him to avoid or stop all such kinds of antidoting things. And we should wait. Sometimes it happens after waiting for 15 to 20 days, the health recuperate. So we don't need to repeat the remedy. But even if doing so, the patient is not getting better, then we repeat the remedy or we give new remedy. Okay friends, hope I have cleared your all doubts with this video. If you have any doubts regarding this video or other than this video, you can message me. You can ask me in the comments. In the comments, I will answer you. For more information or to study more, for more information regarding homeopathy, you can visit the official website of International Academy. Thank you. See you soon.